everybody, Justin Feldman from Feldman Physical Therapy here. Last week, John talked to us and gave us a little explanation about what the joint-by-joint approach is. This week, I want to talk about how we can use the joint-by-joint approach to determine the true cause of your pain so that we don't focus on just your symptoms. If we look at that joint-by-joint approach again, we talk about how we have a really mobile joint that can work with a really stable joint all the way up the chain. I want to start today by talking about low back pain. It's a common problem and something we see all too often. One of the common causes that we see of low back pain is actually your hip. So if we look at your hip, it's supposed to be a really mobile joint. A lot of times this is a place where for some reason people lose mobility. And what happens, you need to end up getting that mobility from somewhere. Where does your body turn? The next joint up in the chain, we go to your lower back. When we get into your lumbar spine, that's supposed to be a really stable joint. Often you create mobility from that lumbar spine, and that makes it do work it's not designed to do, and that results in pain. Thank you very much. Tune in next week when we start talking about how we use the joint-by-joint approach to look at foot and knee pain in runners.